This reward for you.
For me? For what, mommy?
For your good result.
Wow. Let me pick you first, okay? Is it good, mommy?
Very delicious.
What's wrong with you?
Look at them. They look very happy. I wonder when can I get that moment too.
What do you mean by that?
It's been 5 years since I got married, but I still cannot afford to have a child.
I think that's a serious problem. You need to consult with doctor. Let's go. I will bring you.
Assalamualaikum, Doktor.
Waalaikumsalam.
Doctor, can you help me? I have a problem to have a child.
I think this is infertility.
What is infertility?
Infertility?
Infertility has become increasingly significant health concern in Malaysia, affecting many couples across the country. With changing lifestyle, delayed marriage, and environmental factors, the prevalence of the infertility in Malaysia is on the rise. In reproductive technology, many individuals still face the emotional, social, and financial challenges in seeking treatment. Addressing infertility in Malaysia requires greater public awareness, improved access to healthcare, and seeking policies to those who have affected.
What is the causes of infertility?
Here are some key factors that contribute to the infertility for both women and men. First, age. Fertility naturally can decline for both sexes, especially when women after they are mid-30. And for men, maybe when they are over 40, they can experience the reduced infertility. Do you have someone that smoke in your house, miss?
No. Why, Doctor?
Because in cigarette we have tobacco. Tobacco use can prevent the chances for pregnant and also can reduce the effectiveness of the infertility treatment. Last but not least, fallopian tube damage or blockage can contribute to the infertility to occur because this damage can prevent from the egg and sperm from meeting and can be caused by endometriosis. Endometriosis is a condition where uterine-like tissue grows outside the uterus, leading to scarring. This is all the factors that can lead to the infertility.
According to the research, the World Health Organization (WHO) claimed that the infertility rates in Malaysia is within to 10 to 15%. However, the absence of the national data collected make it more challenging to quantify this issue accurately. For example, the Malaysian top singer Datuk Sri Siti Nurhaliza and one of the entertainer's wife, who is Aceh, they are among the people who undergoes the IVF test. On the other hand, there are still more people out there who are still struggling to have a baby. It's just that to differentiate they and the popular artists is their story are not being told to the public.
So what is treatment for infertility? There are 3 main types for fertility treatment. First one is medicine, second one is surgical procedure, and the third one is assisted conception, including intrauterine insemination (IUI) and in vitro fertilization (IVF). What is IVF? IVF is when an egg is fertilized outside the body. Fertility medicine is taken to encourage the ovaries to produce more eggs than usual.
This is the procedure of IVF treatment. The first step is ovarian stimulation. The woman receives medication to stimulate her ovaries to produce multiple eggs instead of usual one. This stage lasts for 10 to 14 days. And the next one is egg retrieval. Once the eggs are mature, they are collected from the ovaries by using a needle inserted through a vagina. Next is sperm preparation. Sperm are obtained from the male partner either from ejaculation or by retrieving sperm from the testes. The sperm sample is then prepared in a lab. Fourth step is fertilization. The combination of collected eggs are combined with prepared sperm in a lab dish. This process, called in vitro fertilization, allows the sperm to fertilize the eggs.
Next one is embryo development. Once fertilized, the eggs are allowed to develop into the embryos in the lab for several days. Next one, we will do embryo transfer. Once the embryo are developed, one or more are transferred to the woman's uterus using a thin catheter inserted through the vagina. Next, for the last process, implantation. The patient needs to wait approximately 2 weeks for pregnancy test if the transferred embryos has already implanted successfully.
According to one of the fatwa in Malaysia stated by Mufti Wilayah, test tube baby from the semen of the husband and wife, which is fertilized respectively, is valid in Islam. Consequently, if the semen and ovum is taken from someone else, rather than the husband and wife, is invalid. I have two rather interesting questions to discuss. Firstly, the ruling of fertilizing the sperm of the deceased husband. The answer is, it is prohibited for a widow to use the stored semen of her late husband with the purpose of conceiving a baby. The reason is, once the husband passed away, their relation as a husband and wife ends. Hence, the semen from a man stored before his death is prohibited to be used by his wife for the purpose of fertilization and conceiving. Secondly, the ruling of surrogate mother. The Fatwa Committee for the State of Selangor has issued a law that states the use of surrogate mother is prohibited. This can be seen through the decision which states using the method of surrogate mother to conceive is prohibited by Islam, even though the sperm and ovum are taken from legitimate spouse, as it will cause the confusion of the nasab of the child to be born.
For conclusion for our discussion is, IVF is a major advancement in reproductive medicine that helps couples with infertility. Despite some ethical and emotional challenges, it offers hope and continues to improve with medical progress. Ongoing discussions are important to ensure IVF remains safe, fair and accessible.